because medical providers, you guys need some help, and so does CMS. They're sending out an SOS right now on the proposals that they came out with in July. They're making a lot of recommendations for proposals and they're asking for comments. Some of these could significantly limit RPM for patients because of what they're proposing. Because honestly, most clinics do not have the internal staff, the resources, the budget. They don't want to go out and buy all this equipment that it takes and then get set up with a HIPAA protected portal and then have to handle the maintenance on the equipment and all like that, which is why they're using RPM companies like myself, AccuHealth or Telehealth or ChartSpan or Care Plan or whatever plan, whichever one they're using, because there's a bunch out there. So the end result is if they did make these changes, by the way, there would be fewer patients that's going to be benefiting and getting this. So let's take a few minutes, about 10 minutes, and talk about this right here. CMS proposed specific requirements that they're or changes that they're making that they would like to see happen for 2027. And as every year they're required to do, they have to publish these in the July or August Federal Register. Well, they did this past week. And as I say, most clinics don't have the bandwidth to be able to do what they're wanting to be done during in all these changes. And we're going to go through these specific changes. So if they did move forward with all these changes, there would be reduced numbers of patients getting RPM. Now, what are these changes? One of the changes is RPM and RTM be furnished only to established patients. That's not really a change because since 2021, that's been the requirement. During 2019, 2020, that there was an opportunity to be able to do it for new patients as well, but that went away at the end in 2021. Providers reporting RTM or RPM services must furnish a separately reportable initiating face-to-face visit. That's brand new. And I got to tell you, I'm not 100% against that because of numbers I'm going to show you in a little bit of some companies out there doing this with patients, and the patients and the doctors have no idea it's coming. Only allow payment for RPM or RTM services when furnished by clinical staff employed by practice. That is a big one. They also want to reduce the number of CPC or CPT and HCPCS codes from 17 to 4 codes for remote monitoring. That may not be such a bad idea, but we're going to wait and see exactly what they figure out the reimbursements would be for those 4. It could be like they did with GO 511 and increase the total amount that they're paying, or it might be that they reduce the amount. We don't know yet because we haven't seen the RVUs that they want to ascribe to the 4 new codes. And they want to reduce the payment amounts overall. And you say, well, why would they do that? And how are they going to do it? They're looking at eliminating the practice expense portion of the relative value units, which that's kind of stupid, really, if they did that. Because the doctors have a practice expense, or the clinics have a practice expense, whether or not it's buying the equipment, doing the maintenance, doing the shipping and the returns, and handling all the repairs, etc., on their own, or whether or not it's them paying a company like us to do it for them. Either way, they have an expense. So why is CMS proposing all these changes? Well, it's because of a couple of different studies that came out. One that came out in 2024, another one came out earlier this year, based on 2025 data. The 2024 report was based on 2022 data, and it's called Additional Oversight of Remote Patient Monitoring in Medicare is Needed. And it came out of the OIG. One, they had CMS conduct periodic analysis of providers' billing. I don't have a problem with that. If you're not doing anything wrong, just be transparent. That's okay. Let them come take a look at it. 2, ordering provider be on all claims similar to Block 17 data required on clinical labs. Number 3, identify on claims which physiologics being monitored. Accuracy in diagnosis should take care of that easily enough just by the specific diagnosis code. 4, require transparency of RPM vendors directly billing Medicare. I'm all in favor of that as well. Because we need transparency in all of the dealings we're doing with on this right here. Conduct provider education. More education is better. That's why I'm constantly teaching, why I'm doing this particular thing right here. Now, why is RPM so important? Well, one report that came out in 2019 showed reduced hospitalizations, reduced ER visits, reduced hospitalizations by 38%. This was called the class report. And then you also had reduced ER visits. And that, I think it was like 25% reduced ER visits. You had reduced hospital readmits. I think that was again 25%. Improved patient compliance was I think that was closer to 13% if I remember from that study. And then in 2024, they came out with another report called from the Journal of General Internal Medicine. They did a study and showed 34% reduced mortality among Medicare hypertensive patients. So what are we doing right now? We're asking for your help. September 14th is the deadline that CMS gave. And whether or not you've ever sent in comments after the first initial Federal Register or not, we need people to do it this time. Because whenever you send in a comment, it's like 100 different people, 1,000 different people out there doing so because they get so few. Well, we need you to let them know how your patients are currently being affected by RPM. If you're doing RPM right now, what kind of results are you seeing? Are you seeing reduced hospitalizations, which again reduces the mess, with the patients? Are you seeing patients being saved, their lives, etc.? And what is the consequence, by the way, to your practice if CMS does require employees of a clinic only? So the three different methods to be able to send in these comments. The easiest is click on the link right here that you have in the PDF, and then just click in there and toss in your comment right there, and it'll show up even in the comments area. Snail mail, Baltimore, Maryland. Express overnight, a different address right there in Baltimore, Maryland. So we need your help, though. We need you to be able to reach out to CMS and tell them what you're thinking. If you would like our help here at TeleCARE USA or Don Self and Associates, either one, we'll help you formulate that comment. How is this going to affect the patients? If they reduce that right there, is it now become not profitable or that you would lose money by doing it? If that's the case, you need to let them know because you're not going to be able to provide service to a patient that they want the patients to get because it's saving them money, it's saving lives, it's saving, hospitalizations and all. So approach it from that regard. Now, on August 25th at 2 p.m., I'm going to have a free 1-hour webinar with a question and answer session afterwards. We'll probably go about an hour and a half is what it's good, typically what it does. And you can register for that by clicking on this link at the end. We've been getting a lot of input on that. I hope this writer helps you. Y'all have a blessed day, and thank you again for letting Don Self and Associates and or TeleCARE USA serve you. We're here to help you in any way we can. Thank you.